Hello and welcome to the Lift Up Journeys podcast. My name is Katie and I am one of the founding members of Lift Up Women in Life Sciences, a community created to connect, champion and inspire women from academia through to C-suite across the life sciences industry. I'm looking forward to sharing with you an inspiring collection of career stories from a group of wonderful women who work in leadership positions across the life sciences industry. I hope by listening to these stories, you will feel inspired in your own career and gain the skills, confidence, and knowledge you need to climb the career ladder and break through the glass ceiling. Thank you very much for tuning in to today's episode of Lift Up Journeys. Today, I'm joined by the wonderful Donielle Johnson, who's joined me all the way from Atlanta today, I believe. So it's truly wonderful to have you with us and to spend some time today, Donielle. So thank you very much for volunteering some of your schedule. And would love to hear from you as a little bit of an introduction into your time in the life sciences industry.
Thank you, Katie, for having me today. I started my career 20 years ago, actually, as an intern at Medtronic out of grad school. I worked my way up from customer service, patient services, to clinical services, and then regulatory affairs, where I've been for probably the last 18 years. I worked in Medtronic at the mothership in Minneapolis. Then I moved to Medtronic in Santa Rosa, California. And I left Medtronic in about 2011 to go to Abbott Vascular, really focusing on drug-eluting stents and bioresorbable scaffolds at Abbott Vascular. It was a great time to join them in the evolution of the drug-eluting stent business. And with a background in chemistry, it was really a great opportunity. And then I had the itch to be an expat. While at Medtronic years earlier, I had done a temporary assignment in Japan working on a project for one of our stent grafts, where I traveled back and forth to Japan for this project. And so when the opportunity presented itself for me to move to Amsterdam, I'd actually known nothing about Amsterdam. So I had actually never visited. I knew that they were known, I hate to say it, for the red light district, so sex and marijuana. So sex and drugs was what I knew. So I'd never been on my list of places to go as a holiday, let alone move. But I was approached by someone at Philips for an amazing opportunity. So I moved to Amsterdam 10 years ago. January will be 10 years that I've been living in Amsterdam. And so I worked as the regulatory leader for a new business within Philips called New Business Development. They took a lot of IP that Philips had in Philips Research, along with some partnerships with other companies like B. Brown to create new products. So I was there for 2.5 years before a mentor reached out to me and asked me if I would like to join J&J. So I then joined J&J leading EMEA in Canada for their medical device division. So I joined J&J in 2016. And in 2020, made the decision to leave J&J to join Bausch Lomb. Bausch Lomb has been a full circle moment for me because in 1996, I was a Bausch Lomb scholar. I won the Bausch Lomb Science Medal for my home state of Louisiana and was a Bausch Lomb scholar. So it's been a real full circle journey. And so I started at Bausch Lomb during COVID as the executive director for regulatory affairs for the medical device business. And they were Bausch Health at the time. And then 2 years ago, I was promoted to vice president, where I focused on still medical devices, government and regulatory policy and intelligence as well.
Wow, congratulations. That's such a journey when you hear it in a short introduction. So you've obviously been working vice president level, which is fantastic. But your career started obviously from your time grad school, I guess. You studied chemistry, is that right?
I studied chemistry, yes.
Wow.
At
What
Howard
was it
University.
about chemistry?
So my grandmother was a chemist.
Oh, that's amazing.
So my grandmother majored in chemistry. She had a chemistry background. She was a teacher. She was an educator. But her background was in chemistry. And so at one point, I started in biology and then I switched to chemistry. And I wanted to go to medical school. And at the end of the day, that wasn't my journey. So I ended up going to grad school at the University of Southern California. So honestly, couldn't I needed an opportunity, and someone presented an opportunity. I didn't know what Medtronic was. A friend of a friend, and God rest her soul, she recently passed away. A friend of mine had a friend, aunt, who was in HR at Medtronic. And I was looking, and she reached out to her aunt, and she said, "Send me your resume." I didn't even have a resume at the time, so I sent her an email, honestly saying I don't even have a resume. She invited me over to her home for a cup of tea in the afternoon, and she helped me craft a resume. She then put it in front of a hiring manager, and I got the interview, and I crushed the interview. But I was looking for an opportunity in pharma. The pharma companies were not hiring at the time, but medical device companies were. I didn't even know what this company was, but it was literally a friend of a friend, who are a friend of her friend's aunt. And I talked to this woman on the phone. We hit it off. She really, really, really helped me, along the process. Um, and when I got into Medtronic, I saw all the great things, that they did. I really believed in their mission. That there were a lot of great opportunities for me to grow and move around in the company. Um, and so, yeah, I fell into industry. It was never a plan. It was something I fell into. And I think the best part about it is how I got there and how I stayed there has always been through, I would say, mentors and sponsors. I tell people, every time I talk in like career talks, I always tell people, yes, I'm very smart. Yes, I'm a hard worker. But in this industry, it's about relationships. And I've, along my journey, have had great people who have been mentors and sponsors to me that have helped me to continue to grow in my career.
When in your career did you have your first mentor? Was it when you first joined Medtronic?
I would probably say probably a year in. So Medtronic has employee resource groups. Most large companies have that. And they had an African American employee resource group called MECA. And I think they have a new name now, but it's still there. And they had a mentoring program, and you could sign up to be paired with a mentor. So I had gone to like an informational session or something, and I signed up because I was like new. It's a big company. I didn't know people. So I signed up, and I was actually paired with the woman who led regulatory affairs for the pacemaker business. And in a mentoring session one day, she said to me, with my mouth and my brain, I was in the wrong role within the company. I should consider regulatory affairs. I actually had no idea what regulatory affairs was. So I went home and Googled it. And this program at Northeastern in Boston came up. Nowadays they have all those fancy PhD and master's programs in regulatory. Back then they did not. You could get a certificate. So Northeastern had a certificate program, but it qualified for tuition reimbursement from Medtronic because it was a graduate level course at an accredited university. So I signed up. I was like, what I got to lose? The company's going to pay for it as long as I pass the class. So I signed up for these 5 courses introducing you to the Food, Drug, and Cosmetic Act, the medical device directives. And I was like, I could do this. And then there was an opening. Medtronic had purchased a company in Santa Rosa, California called AVE. There was an opening there. My mentor introduced me to the person who was going to be leading the regulatory affairs group there. And the rest is kind of history.
Wow, that's fantastic that you've almost fallen into regulatory, but because a mentor has seen those soft skills and seen those characteristics that you had that meant you were a good fit for what the regulatory profession did. That's really interesting. Do you find now, looking back, that it's quite obvious to you now that your soft skills match what regulatory professionals are very good at?
Yes. So people always ask me, like, well, when you say regulatory affairs, what does that mean? And I always tell people it's my job to explain the science and technology behind our products to ministries of health around the world to prove that they're safe and effective for sale, right? But it's also my job to explain the requirements of testing to my engineers to be sure that they test the products, right? So when I think about regulatory, I think it's the perfect mix of art, meaning storytelling, science, and law, right? And so for me and my personality and who I am, I think it's the perfect fit for me.
That's fantastic to hear. And I love the fact that a mentor has seen that for you, because I think
Way
we
before
so
I
often,
saw it.
which is amazing, because we so often think, oh, I should get a mentor, but a lot of people don't sometimes understand the value of having one. But this is a great example of the value that someone has demonstrated to you, because you've progressed all the way from your first role in regulatory affairs to VP level most recently.
Yeah.
So it's great to hear. Tell me a little bit more about that transition from Medtronic to the company they acquired.
It was still a lot of Medtronic people, right? And it was still small enough that we were still building a culture. So for me, the biggest transition was coming from a corporate environment in Minneapolis to I would say, a satellite office in California. And just, Midwest people and California people are totally different, right? I would show up at the office at like 7:45, 8 a.m. in a blazer and trousers, and people are like, are you interviewing somewhere? Tech companies in California, people show up at 10 o'clock in jeans and a polo, right? So, but at the time we were working on groundbreaking thoracic devices and drug-eluting stents. So I was part of the team that got Medtronic's first thoracic stent graft approved. At the time, there was only one product that they had, which was an abdominal stent graft. At the time, they were also working on drug-eluting stents. I wasn't working on drug-eluting stents at the time, but Medtronic was. So the office out there was doing a lot of innovation. And so I think the transition was great. I think moving to Santa Rosa in my 20s, it's the wine country. I was not a wine drinker. So from a personal perspective, it was a little bit boring. Now my friends call me a wine snob, but back then I was not even a wine drinker. So I think that was it. Like, it's a little bit of an older crowd, I would say, there. But also meeting my people there, right? Getting your community set up there is kind of what kind of kept me and motivated me there.
Yeah, and that must have been quite daunting, because obviously being very young in your career at that point and moving out to California, it's a big change. Did you prioritize making friendships with people that were in that area? How did you go about building that network?
So, I guess for me, I've lived everywhere. So moving to the Bay Area wasn't really a big change for me, because I had gone to grad school in LA. So I moving to Minnesota was a bigger change.
Very true.
With the weather for me. But I'm from New Orleans. I went to undergrad in Washington, D.C. I went to grad school in L.A. I then moved to Minnesota to then move to the Bay Area. So it wasn't a big change. I had some friends built in from my home in New Orleans that lived in the Bay Area. But just building community in Santa Rosa, which is an hour and 20 minutes north of the city. We were a lot of young, I will say this, the people I started my regulatory career with, most of us was fresh out of grad school. We were young, we were ambitious, we were eager. Some of them are VPs now, executive directors, senior directors. So we were all growing together. So building that community was important. And at the time, Medtronic had a new head of HR who was an amazing woman who kind of adopted me into her family. And would invite me over for Sunday dinners and things like that. So Santa Rosa is kind of a small town. At the time, I know it's much bigger, but all you used to see out there were vineyards and wineries. Really,
sounds wonderful. I'm on my way. It sounds wonderful. Oh, lovely. So that was a great experience. And then along came Abbott, I believe.
Yeah. So after 7 years at Medtronic, it was probably one of the toughest decisions I ever made to leave. But I knew that if my career was going to continue to grow, it would have taken me back to Minneapolis. And for me, going back to Minneapolis at that time in my life was just not where I saw myself. I'm a New Orleans girl. It was definitely very, 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 very cold in Minneapolis. And a few years prior, my mom had come to live with me, and she passed away in Minneapolis. So I didn't want to go back to Minneapolis. So when the opportunity presented itself to go to the next level at Medtronic, it would have taken me there. So I would have either been stagnant in my career to stay in Santa Rosa, because there wasn't any growth in that business at that time, or I could take another opportunity. So there was a French company called Biomérieux, who had offices in Cary, North Carolina, and St. Louis, Missouri. Or there was Abbott Vascular. I actually chose the admin vascular role because it was going to be the first time in my career that I would be able to work for a Black woman. Um, and I was impressed with her in my interview. I felt like there was things that I could learn from her. And honestly, as a chemist, I've also felt like it was finally, in a device space, utilizing my chemistry side as well. So learning CMC from a regulatory perspective and not just, the device mechanical biocompatibility side and the, in vitro bench testing side. So, and it was still in the Bay Area. So instead of North Bay, I was going South Bay. So I wasn't really going far.
Yeah, that's wonderful. And it's great that actually you noticed that being able to work for the first time for a Black woman as your boss must have been a really incredible experience, because we all know how underrepresented gender is, definitely how underrepresented women are in our industry, and also the ethnic minorities. We don't have the broadest scope, do we, in terms of people's race in our industry. So it's wonderful, I guess, for you to be able to point that out and say, actually, for the first time, this is the first opportunity I could work for a Black woman. And it's great that that was something important to you, and I'm sure it still resonates today.
It does. And it's so funny because I get people reach out to me all the time as well. And I'm a part of a mentoring program with a program called SMDP, Scientist Mentoring Diversity Program. It's a 1-year virtual mentoring program where we mentor diverse scientists that want to come into the medical device field. So I'm African-American, Latino, Native American, and they're working on either engineering or science degrees in pharma, chemistry, biology. And we mentor them. And the reality is, even in 2023, going into 2024, gender and race matter. We have gender and race. I mean, the best way to say it is that there's still barriers, right? The glass ceiling does still exist for women and minorities. And so, I as busy as I am, the one thing I'm always committed to is the SMDP program. Is virtual mentoring. I meet with my mentee once a month. People graduate out the program, right? Because it's a 1-year program, but I still keep in touch with all of my mentees. I tell them I'm just a phone call away. I'm invested in their success, because I wouldn't be where I am today without great mentors. I still have mentors now. I have a lot of great sponsors. So I always tell people, you got to know the difference between a mentor and a sponsor, right? And why they are both important, right? Having one is great, but having both is a real key catalyst in your career. And I think for me, that's been very key in my career.
Absolutely. I think it's so important to recognize that mentors and sponsors are two completely different people. Sometimes they can be the same person, but they have two very different roles to play. And I think we always need to focus on the difference of the two, the importance of having the two. It's something that we talk about very frequently in our Lift Up community, actually, is really being able to educate women on why they should have both a mentor and a sponsor. And I think even being able to look at having an executive coach as well, or a leadership coach as a third person, there's absolutely no harm, because the more people you can learn from, the more you are growing as a person, the more knowledge you're gaining, and the more you're networking too. I think that's really important. And I guess how that relates into your journey as well. So you were with Abbott for a number of years as well, weren't you? Did you start to take on more mentoring responsibility yourself when you worked at Abbott? Was that the first time that you started to maybe think about mentoring others as well?
That is correct, actually. So Abbott participates in this program, the Science Evening program. So Abbott in the Bay Area, because I was specifically at Abbott Vascular, which was formerly Guidant before I joined. Abbott Vascular participates in this minority science program. They also participate in these health screenings. And so when I was at Abbott, I participated in the minority science program. And so I was mentoring middle school and high school kids. And it was totally different because you're talking about going to college and careers in STEM and why STEM is fun and why does it matter and things like that. So it was mentoring. I call it my mentoring training, right? Because kids are brutally honest. So I started working in that program in the evening. So we would do the science programs in the evenings. We partnered with maybe 2 middle schools and 2 high schools. And I was mentoring in that program for a couple of years.
Fantastic. And as you said, kids are way more honest. They're way more brutal with their questioning. So it's probably set you in good stead to then be able to start to mentor industry professionals as they come through as well. So yeah, that's always really interesting. I think that's a turning point for everybody's career is when did you then start becoming the mentor for others? When did you then feel confident enough to be able to give back to other people and help them to explore a career? And particularly because you're a regulatory professional by this point, and regulatory, I think most regulatory professionals would be open to share that they kind of fall into the profession. Not that many set out studying at university to be able to start a career in regulatory. It's not.
Well, if you think about it, those programs are all brand new, right? If I think about when I started my career, in my regulatory career back in 2006, those programs didn't exist. There was no master's in regulatory affairs. There was no PhD in regulatory affairs, right? I think most regulatory affairs professionals that I know that are my age or older learned on the job. They had a scientific background or maybe even a legal background, or they had a quality background and, quality got merged in with regulatory, but it wasn't a lot of on the job, right? It wasn't these fancy schools. And I will say this, I have to credit my first regulatory boss. I say, oh my God, he hovers. But Bill was a great teacher. I actually think he should have gone to teach at a school. My first regulatory boss, Bill Hyatt, was an amazing teacher. And I soaked all of that up like a sponge. Because you didn't have access and you learned by making mistakes on your 510K, by making, mistakes and getting questions from the FDA on your PMA, by having difficult conversations or audit findings with the notified body. So,
And it's stood you in really good stead now, hasn't it? Being able to learn on the job. It's throw yourself in at the deep end and just learn as you go, and not maybe having that educational background, maybe not knowing exactly what to expect with policies, procedures, but being able to pick it up. And maybe this has also been really good for you to be able to lean more on your network and ask your network questions, because you would have had to have gone out of your way to approach people to ask for help, wouldn't you? And I think that's something that we always need to remind people is so important. Ask for help. If you don't know, you don't need to be the expert, but it's your job to be able to go and ask somebody when you do need support.
And you also have to question things, right? I always tell people, to be a good regulatory affairs professional, you have to look at the science and where the science is leading you. You also have to look at the business side. You also have to have a change in a growth mindset. I mean, over the last 5 years, we've seen so many changes from a regulatory and a policy perspective. And as technology grows, right, as a scientist, as technology grows, the requirements are going to grow and change. So change can't be scary for you, because the only thing constant is change. And honestly, if I'm not learning something new, I feel like I'm dying. So you have to also continue to grow, right? And you can't do that if your mind is one track. If you're like, you know what, I'm only thinking this way in this siloed box.
Yep, absolutely. And with changing growth mindset, it's personal and professional, isn't it? It's being able to take on that approach into your personal life, but also what you're trying to achieve in your own career and the professional life as well alongside of that. That kind of leads me on to a big change in your life, was relocating to Europe, wasn't it? Was it at this point, when you'd been working with Abbott for a number of years, that you started to think about what it could be like to be an expat?
Nope. Once again, somebody I knew. So a vice president that I had worked in his business at Medtronic had taken the chief marketing officer role at Philips. He was in a meeting. They heard about this new business they were starting, reached out to me and said, hey, would you ever consider moving to Amsterdam? And I said, absolutely not. Sex and drugs. I don't even have a desire to visit Amsterdam, let alone move there. So then it was, oh, I think you should just talk to them. I had a old school. This is very old school. I had a Skype call. I'm like, I don't even know if Skype is still around. I had a Skype call on a Wednesday and had a really great conversation. And at the end of the conversation, the guy was like, well, what are you doing this week? And I was like, I don't know, laundry. So I was telling him I had never been to Amsterdam. So they flew me out on a Friday. I got to Amsterdam on a Saturday. I spent Saturday and Sunday exploring Amsterdam. Then I went down to Eindhoven, which I called Eindhoven for like a year. I went down to Eindhoven on a Monday. I met with a bunch of people at Philips on Monday and Tuesday. By the time my flight landed back in San Francisco on Wednesday, I had a job offer. That was in 2013. That was in October of 2013. December of 2013, on Christmas Eve, I was home in New Orleans cooking with my family when I got the message that my visa had cleared and I could start work on January 1st. I was like, wait, I haven't quit my job. I haven't packed a house. And so I ended up going back after Christmas to San Francisco, letting my new boss at the time know that I was going to take this adventure. And I think for me, I felt like I was in a slump at the time, both personally and professionally. So I felt like it's going to be an adventure, right? This is a new country. I don't know the language. I'm moving really far away from my family. But it wasn't something I woke up one day and said, I'm moving to Amsterdam. It just once again kind of fell in my lap. And I said, when I got there, I was like, what did I do? I signed a contract that said I'd stay at least 2 years or I'd have to pay these people all this money back. So I was like, what did I do? But at the end of the day, it ended up being, I thought I could do anything for 2 years. 10 years later, I'm still there.
Wow. That's amazing. What is it you enjoy about being over in Europe? What's kept you here?
So I would say this, easy accessibility to I can be in another culture in an hour, right? So I do love one of the things I on my political soapbox, I feel like we would have less conflict in the world if people would really spend time truly getting to know one another. I believe that we are more alike than we are different. And the one thing about moving to Europe, especially for me, has been to explore new cultures, new customs, new foods. I believe everyone can connect around food. I'm a foodie. I love to cook. I love when people enjoy my meals. I love to enjoy different meals and different customs and cultures. So I think that was the biggest for me. But then the second business was the mindset of this work-life balance, which I still don't believe exists. Was that I find that the Dutch, they work so that they can live. I find that Americans live to work, right? I mean, if you walk down any street in Amsterdam at 6 o'clock, you'll see people with their curtains open with their candles lit, sitting at a table having dinner. Right. I feel like that between that time of 5 and 7 is considered sacred family time where people are not at the office. They're at home, sitting around, talking to their families, having dinner. And so for me, it was just a different lifestyle. And for me, because I had never visited Amsterdam, I really had no preconceived ideas. But it was very interesting. My journey to find a house was interesting. It was actually chronicled on the US TV show House Hunters International. Took me 8 months to find a house. And yes, I still live in the same house from the TV show.
You're not moving again, are you?
That experience was, but it also showed me how different. So like, for example, like we have big refrigerators in America, we have ovens. Most places in Amsterdam don't even have an oven. So it was just they have a cooktop and a microwave. And I was like, no, I can't deal with this. Or like people don't have washer and dryers in their homes. And so there were just some things. And so it took me 8 months to find a flat that met my needs.
Yeah, absolutely. How did you adjust with your mindset?
I had to think about what were my true non-negotiables, right? Like for me, I know cooking is so important to me. So the kitchen was very important. But at the end of the day, I was like, okay, well, what if I didn't have a washer and dryer, right? I don't have air coat. So that was an adjustment for me. Like there's no air coat. I don't have closets. I have wardrobes that I had to buy from IKEA. So I'm like, okay, I got to become a minimalist. And I still have too much clutter. Like I need to Marie Kondo my whole place and edit it down. But those were like some of the adjustments that I think I had to make. I don't ride a bike. Like the biking in Amsterdam is a big thing. And I've been there 10 years. I still don't own a bike. Because I had to realize that there are some things that are just not for me. So like I take the tram. I do have a car as well. People are always like, you have a car in the city center of Amsterdam. And I'm like, yeah, I do. But I'm mostly a walker and a tram rider. But I realized the biking thing, if you didn't grow up in Amsterdam, like maybe if I lived in a village, but I live in Amsterdam city center right by the Anne Frank house. So the crowded epicenter of Amsterdam. And so biking's not my thing. So one of the adjustments I think I had to make was also too is you can't pack your schedule because you're not just running around like in your car right everywhere, right? One of the best adjustments for me though too is the markets are smaller, my refrigerator is smaller, so you're not packing, you're buying fresh, so you're shopping a little bit more often. Like I shop twice a week, sometimes 3 times a week, because I have a refrigerator the size of what I had in my dorm in high school. If I look at my refrigerator in the house here versus the refrigerator I have at home in Amsterdam, it's night and day. Night and day.
It's a big change, isn't it? It's a big change. And these are some of the really little things that I don't often think we take into account. But I love your mindset to saying, hey, this is just an adventure. This is an opportunity. Let's go explore. Let's see what happens. But clearly it's been so positive for you because you've been here for 10 years, but also your career has accelerated in the time you've been here too. Talk me through the last couple of moves in your career to be able to reach the VP level that you've been at.
So I was at Philips, and I would say this, I would probably still be at Philips if a mentor hadn't reached out to me to come to J&J. So I was at Philips. I was enjoying Philips because guess what? I left work at 5 o'clock. They are a Dutch company. I couldn't remember the last time I had a job where I actually left work at 5 o'clock. So I would get to the office at 8:30. I would leave the office at 5. And I was there for 2.5 years. So I was there for 1 year before my mentor reached out to me, and she had an opportunity to come back to the U.S. To work for J&J in Washington, D.C. And I was like, I'm just starting to get my bearings in the Netherlands. I want to see how this goes. So a year later, she called me up. She said, you still love living in Europe? And I said, yeah, I do. And she's like, I have an amazing opportunity. Now, for me, this was a huge leap because I was a senior manager at Philips. And this is a senior director role at J&J. My whole career, I've always been connected to R&D, so new product development. This was a regional role. So I was like, wait a minute, you want me? And I've had people leadership experience, but I had not had pure regional experience, right? I had done some Japanese work, I've done a CE mark, but, US, but I was really focused on the R&D aspects of regulatory under new product development. And I would work with the people in the regions by giving them, the scientific information they needed. But I was not versed in the regulatory requirements outside of EU. And EU was changing, right? I joined J&J right before MDR was published, right? When everybody's debating the merits of what should be in MDR, which I think was the best time, right? Because everyone's learning now, everything is new. But at the same time, I have all of these other important geographies like Russia, Saudi, UAE, right? Egypt, Kuwait, that were important to the company that I knew nothing about. So I took that adventure. And the one thing I'm is a people person. So, I visited, met with ministers of health, joined the trade associations like MECOMED, like IMETA, became active, really wanting to understand. I always tell people, once again, I think we have more in common than we have different. So what problem are you trying to solve for? What's driving you to create a new regulation, right? We all know MDR was created because of the PIP breast implant scandal. Do I believe PIP would have, MDR would have prohibited PIP from happening? Absolutely not. Fraud is going to be fraud. You're going to have people that are going to commit fraud, but understanding why, and then also offering alternatives. So you have Kenya, for example. They created this brand new regulation, them and Bahrain, around the same time, that's very prohibitive to companies. and to their Ministry of Health. They have 2 to 10 people, and you want people to submit full technical dossiers. Do you even have the time and the workload, the resources to review that? So, I mean, I think I became a more well-rounded regulatory professional by taking on 4 years of a regional role. All right, I stepped back away from the innovation to really focus on the needs of the regulator and how those needs impacted my business. So I do believe that it made me a better regulatory professional, but also a better executive from a decision-making perspective. So I was at J&J for 4 years. And then there were lots of changes, and another opportunity presented itself to help, to restructure a department at another company during COVID, and to work with someone I had admired and worked with in the past. So I took it.
Oh, fantastic. And that's where you've been up to most recently, the team Bausch Lomb, I believe.
Yep. Been at Bausch Lomb. We were Bausch Health when I joined. But as everyone knows, it's public knowledge, the company is separating. We're still in the separation phase. So the company's been separating for the last couple of months, year probably. And so I'm now on the Bausch & Lomb side. So there's Bausch Health on one side and Bausch & Lomb on the other side. And I'm on the Bausch & Lomb side.
Fantastic. And can you tell me a little bit more about what it's been like to be a woman in the executive leadership teams most recently?
So I'm actually what they call an L3 in the leadership fall. I think one of the things that drew me to Bausch Health originally was on the executive committee. There was more diversity, right? There were 2 women. Normally, I hate to say this, the C-suite always has the one woman as the HR person. The general counsel at the time was a woman. She still happens to be my mentor now. She's since left the company. But she was a woman, the HR head woman. The head of R&D was an Indian man. The head of quality was an Asian guy. So the diversity on the executive committee when I joined the company was definitely it was different. Like I said, what drew me to the company initially was I felt like it was kismet because I was a Bausch & Lomb scholar back in high school. I won the Bausch & Lomb Science Medal when I was in high school. And so I was like, oh, it's kismet. But the person that was the VP at the time for regulatory was someone I respected. I'd worked with in the past at J&J. And I guess his mission or his vision for the department resonated with me, right? And what he wanted to do. And I felt like I could contribute and help him accomplish what he wanted to do with the department. And so for me, it was also, I get that itch around year 4 of what's next. So between 4, like I said, I have to constantly continue to grow and learn. So between years 4 and 5 is where I start to get that itch of what's next. Are there other opportunities in the company I'm currently in that I can, move or grow, or is it time to move somewhere else?
Yeah, I love that. And I think that mindset is so important. It's a growth mindset, isn't it? It's how do I grow? How do I continue to develop personally, develop professionally? And that, I think, is wonderful advice in itself to anyone listening, is to really try your best to adopt a growth mindset and set some goals along the way. And for you, Donielle, what's been the biggest learnings for you in your career?
That no one's going to take care of you like you. I think we've talked about this before, is that you cannot pour from an empty cup. I think I have been, because people always ask me, like, you're 44 and you're a vice president. I have to let them know I became a vice president at 41. So, 42, I was almost 42, or I just turned 42. Is that I realized that I have sacrificed a lot of my personal life. I am not married. People ask me all the time, I'm not married. I don't have kids. I have a lot of great kids in my life, but I do not have biological children. And what I've realized recently is that some of those sacrifices, I won't say regret them, but I wish I would have done things a little bit differently, right? So only you can protect, I guess, your time, right? And no is a complete sentence. And when you're saying no to something, you're saying yes to yourself, right? So if I could give anyone advice, I believe work-life balance doesn't exist, but I think we should strive. Someone told me recently, you should strive for work-life harmonization, right? Is that I love the Dutch mentality where they work to enjoy life, that their life doesn't revolve around their work. And so if I could give 20-year-old Donielle some advice, it would be leave the office at 6 o'clock or 5 o'clock and go out on that date with that guy. Don't say, oh, I can't go out on a date with you because I'm working late, right? Don't turn down drinks with your girlfriends to work late. Don't cut your vacation short for something that could be handled by someone else, or that could be handled when you come back.
Yeah.
Right.
I completely agree with you. And I think the one takeaway I learned from one of our Lift Up live broadcasts about 6 months ago was that actually the to-do list, it doesn't end. So even if you get to 5 o'clock in the afternoon and you think, oh, I've still got these 3 things remaining on my to-do list, you can guarantee if you cross those 3 things off, your mind will then go, oh, I also need to do this and this. And the list just doesn't stop. And it actually doesn't make too much difference. As long as you prioritize your workload, the next morning to be able to come in and pick up on the things that weren't done the next day, I think that's where we are probably all guilty of doing things like that, where you just keep going and going.
Well, and also at the end of the day, these places are businesses. I mean, no offense, we get paid to do a job. We don't get paid to give our lives over to a company. What I will say is that over the last year, what I have learned is that you can't get time back. I will earn and lose money probably till I die, but I don't have the luxury of time, right? My biological clock is running out. My nephews are getting older, right? They're not getting any younger. So, missing school events, missing, things like that, I can't get that time back, right? At the end of the day, the companies are there to serve their best interests and their bottom line. You have to look out for yourself, your best interest, and your bottom line. And that's why I say there's no work-life balance, but work-life harmonization. I think and I think a lot of us are afraid to say no to things because we think that's going to pigeonhole us, or we're not going to grow, we're not going to do, certain things. But at the end of the day, we have to decide what's important to us.
Setting goals, and it's setting boundaries, isn't it? As we said earlier. It's wonderful.
Boundaries
advice.
are very important.
Power in saying no. There really is. I think we're all human, aren't we? We can only take on so much. So that is truly wonderful advice. Well, thank you, Donielle, for sharing that. I think that is so honest of you, and I'm sure it will resonate for so many people, no matter what your background and no matter what your discipline is in our industry nowadays. I think that will really, really resonate. So thank you ever so much. And thank you for joining us today, Donielle. It's been a real pleasure to hear your authentic story. And I really do believe that by sharing your story, it's going to inspire many, particularly other women in our industry as well. So thank you very much for giving us the opportunity.
Thank you so much for having me. I enjoyed it. Have a nice day.
Thanks, Donielle. You too. Speak to you soon.
Bye-bye.